Hi guys, this is your pharmacist Sidra and welcome to my channel Ask Your Pharmacist, where I talk all about health and pharmacy. So today's video is very close to my heart because I'm gonna share my personal life-changing experience of sciatica pain. A few weeks ago, I posted this video on weight loss in which I shared my weight loss journey after having limited mobility for 2 years because of my sciatica pain followed by back surgery. First of all, I want to thank you guys so much for giving so much love and appreciation on this video. And secondly, thank you so much for showing concern about my health. I just felt out of the world. I just felt so loved. But many of you guys have been messaging me and commenting on this video asking me to share my experience with sciatica pain in detail because I guess so many of you can relate to sciatica pain and the back pain associated to it. And I can tell you this, it is terrible to have. I've experienced it, I've been there, I've done it, and I wanted to share my journey to help you guys. So here I am today. I'm gonna share my very candid experience, how it made me a completely different person, both physically and emotionally. So let's get going. First of all, I want you to understand what is sciatica pain. So sciatica is your body's largest nerve that runs down from your back down to the back of your leg on each side of the leg, and it has a direct effect on your ability to control and feel your legs. It is that important. So when this nerve is pinched, irritated, or inflamed for some reason, it causes sciatica pain. Pretty self-explanatory, right? Now this pain is almost always related to back pain because when something is injured or puts pressure on the sciatic nerve, it can cause the pain in the lower back that spreads on the hip, buttocks, and the leg. However, some people don't experience back pain at all. Like for me at first, I did not experience any back pain for the first 2 months, but later down the road, I did experience back pain, which I'm gonna talk later in this video. For now, I'm gonna share how it all started, or actually what triggered my sciatica pain. So just about 3 years ago, I went to Dubai for a very short, fun 2-week trip. For someone living in US can already cringe on the long flight from US to Dubai. It's like you're going to the other part of the world, right? So I took this non-stop 16-hour flight each way, and this flight was like within 2 weeks period. And during this awesome trip, I am so glad that I did not feel fatigued or any pain. But when I came back, like literally when I was driving home from the airport, I started feeling pain in my right leg and my back, like my lower back. And I took it as a normal fatigue, fatigue after a long flight. But the pain was there even a week later. And that's when I realized that, okay, probably I have the sciatica pain, or the long flight probably triggered the sciatica pain for me somehow. And at this point, I still did not panic at all because, this pain is very common. As many as 40% of people will get it at some point during their lives. It's no big deal. And it becomes more frequent as you age. And up to 90% of people recover from sciatica pain within a few weeks with no problem whatsoever. And this is exactly what I thought in the moment because I was otherwise a very healthy individual, no medical issues, never went to doctors, followed a healthy lifestyle, worked out. But little did I know that probably I jinxed myself. For me, this pain almost made me a disabled person. I was rushed to the ER for an emergency surgery and was bedridden for 2 months. Probably not a big deal for some people, but for someone like me who is very self-sufficient, always active, used to working 6 days a week, often 10 to 12 hours shift. Now, all of a sudden, I was in bed all by myself. My sister had to feed me, take care of me, and a part of me felt terribly helpless. But another part of me started to count the blessings I've had all my life. I kind of realized how we overlook our blessings all the time. Something as simple as being able to walk. I never appreciated that until I could not walk. Until my doctors told me that, You're always going to have a limp when you're walking, and you may become paralyzed, or you will never be able to run. It was, it was devastating. But regardless of all these voices, going through an extreme and rare complication of sciatica pain, which I'm going to touch in a little bit, I did not give up. I was very focused on my recovery. And I had faith in God and believed in myself that, yes, I got this. I will fight through it. And that's the kind of positive vibe and motivation I want you guys to take from my story. Like, really. Otherwise, there is no point of sharing my story. Really, if you could take anything out of my video, please do try to take that motivation, that focused attitude, that positive energy. And I hope I am able to share that through my words and through my actions throughout my channel. All right, I'm going to talk more about it, but for now, let's talk about the symptoms of the sciatica pain. So sciatica is a very distinct type of pain. You are experiencing pain that flows from the lower back, like right here, if you can see, like the lower back, and runs down into one leg. And this is like a typical scenario of a sciatica pain. And typically, it affects just one leg and may get worse when you sit. The leg may also feel numb, weak, or you may have a tingling sensation at times. And numbness is actually a big symptom, and it was the most distinct symptom in my case. And I felt numbness in my lower leg and foot for almost a year. In fact, it took me almost 6 months of workout before 80% of my numbness went away. And here I'm talking about like regular heavy lifting workout 3 to 4 times a week, like doing cardio, weightlifting, or strength training. And I was doing that with my trainer. So really, it wasn't like that I was going easy on it. I was really working hard, but still it took me almost 6 months of this heavy workout before that numbness went away. Yeah, the numbness due to sciatica pain is so bad and is like long term, because really it takes time for your body to recover, maybe a few months or sometimes even years before your sciatica pain completely wakes up. And it really depends how hard you work out or strengthen the muscles around the sciatica nerve to help it wake up. And in my case, my doctors told me that it may take years, but I was not going slow, trust me. I went with full force. And you know why? Because my doctors and physical therapists had told me that for the kind of damage I have, it is really hard to recover. I may recover like 60-70%, but may not fully recover. And I did not believe that. I had faith in God, and honestly, I could not let any doctor or therapist define my destiny. So I gave my best and God helped me. And look at me now, like I am a healthy, fit individual in front of you. But in order to gain that, I would say it's very important that you understand how the nerve recovery works. And also you have to stay focused and you work out really, really hard. You have to give your all in order to get fully recovered. So really, to help you understand the science behind the nerve damage, I want to give you this example. So see, think of a couch or any furniture that you put on a carpet, and that continuously, the weight of the couch or the furniture continuously pinch the threads of your carpet, right? So when you remove the weight of the couch or the furniture over the carpet, it will take some time for the carpet threads or wool to kind of rebound, right? Similarly, if the bulging disc from your vertebrae, the bulging disc from your vertebrae is pinching your nerve, once you remove that disc causing pressure, it will take some time for nerve to come back. So meanwhile, you will experience numbness, especially in the parts of the leg where the nerve damage has been done. Makes sense, right? All right, moving on. Some other symptoms that I experienced were pain with sitting in the beginning, which actually started, like I said before, after I returned from a long 16-hour flight. This pain continued for about 2 months, and I can tell you this, it was terrible. It was not fun at all. Like for me, with my pharmacy job, I am on my feet all day. And it was so hard for me to be able to sit after a long, tiring day. Therefore, I literally had so many sleepless nights. Like, no amount of pain medication was good for me. Mainly at first I use over-the-counter pain medications, but I even got the prescription medications like tramadol for generalized pain and Neurontin for nerve pain. And since these medications causes a lot of drowsiness, I will be sleepy all the time while on the medication. But the minute I wake up, I will start to feel the same excruciating pain again. And those of you who have experienced sciatica pain can relate to me here that this is terrible. Like 10 out of 10 kind of pain. I just feel so emotional thinking or talking about it. Emotional not as in saddened kind of emotional, but thankful for the recovery. Thankful for all the blessings, and if anything I learned from this experience was self-care and thankful of my blessings. I hope you also take that away from my experience because that's very important. Anyways, coming back to the pattern of my pain, so it shifted. Like for 2 months, I had more pain while sitting. Then for almost 2 months, I had manageable pain because of stretch exercises and the physical therapy I was doing. But then the pain came back again. And this time being worst when I was standing. And boy, it was hard. Like I still remember one evening I was working in the pharmacy. It was so busy, like the evening rush hour, and I started getting this excruciating pain. But I'm just such a workhorse that in that moment, I'm not thinking about my pain. I'm just thinking, oh, if I go home, I'm gonna have to shut down the pharmacy. Then what about all these customers, how they're gonna get these medications? They're gonna get upset, they're gonna suffer. But girl, you are in pain. Like, come on. Like, you need to look out for yourself. Yeah, that's me. And I'll be honest, such oblivious behavior made my condition worse and complicated. And if anyone watching this video is a workhorse like me, listen, if anything you must take away from my experience is to listen to your body and do not ignore the signals it's giving you. Like even if you're a fighter, you still want to pay attention to your body. Like if it's telling you, no, I'm not feeling good, just listen to it. Take a moment and step back from all the responsibilities and take care of yourself. Because only then you'll be able to take care of others. It's as simple as that. See, I didn't listen to my body and I just worked, and my condition got complicated. Now, I wouldn't say that I regret it, but I think it was a lesson learned. Because now I realize that had I taken care of my problems sooner, my nerve wouldn't have that much damage. Because yeah, soon after that evening, I was limping. Not for just months, but 2 years. That was a lesson learned hard way. Anyways, let's switch gears and talk about what actually causes sciatica pain. Now, the most common cause of sciatica pain is herniated disc or a bulging disc, and there are many other causes of the sciatica pain as well. Like when your spinal canal gets abnormally narrow, it causes the sciatica pain because it's then pushing on the nerve. But for this video, since I'm sharing my personal experience, I'm just going to stick with the herniated disc, which was the cause of my sciatica pain. So there are discs between your vertebrae. Imagine these are your vertebrae, like the top and bottom. So there is a cushion between each of your vertebrae like this. So this is your vertebrae and this is the cushion. And this cushion is basically the disc. And this disc absorbs the stress and shock the body incurs during movement, and it also prevents the vertebrae from grinding or collapsing against each other. Now, these discs do tend to get weaker as you age and become more vulnerable to injury. And sometimes the gel-like center of a disc pushes through its outer lining and it presses on the roots of the sciatic nerve. So about 1 in 50 people will get herniated disc at some point in life, and up to a quarter of them will have symptoms that last more than 6 weeks, and the remaining will recover with physical therapy, rest, walking, or using some over-the-counter pain medication or stretching exercises, which by the way, I will be posting a video on stretching really soon because those stretches are great to help relieve sciatica pain. And even if you don't have sciatica pain, These stretches are great to prevent the sciatica pain. It kind of helps stretch those back muscles of the leg and kind of prevents my sciatica pain from reoccurring. All right, so moving on. Now the question arises, how we find out that we have herniated disc? Well, simply by a CT scan, MRI, or an X-ray. Now, these are three different tests which show three different results or three different things. Like an MRI can show the alignment of vertebral disc, ligament, and it also shows the muscles. A CT scan, when done using a contrast dye, can actually provide a useful picture of the spinal cord and the nerves. However, X-ray can help identify any abnormalities in the bone, but it cannot detect any nerve problem. Basically, the point of having all these tests is to determine the cause of sciatica, because that can help guide the course of treatment. Like for me, I got my X-ray and MRI for the diagnosis of my problem. I got my MRI after suffering for at least 6 months. Okay, I can explain why 6 months. Well, the first reason, I confess, it was my negligence, which I don't recommend you do. Well, I happened to do that because being an overall healthy individual and in my mid-20s, I was in a disbelief about the fact that I may have a herniated disc. So really, instead of making time for myself, making sure that I get proper diagnosis and all, I did not listen to my body. I just preferred to work and neglected my health, which is a big no-no. Please don't do that. Secondly, I think I would have to say that there is a loophole in this healthcare system, honestly. It's not the greatest when it comes to insurances and healthcare, because the insurance will pay for an expensive test like MRI, which costs about $1,500 to $2,000, which by the way is almost 3 lakh Pakistani rupees. So the insurance basically wants doctors to first try and fail other treatment options and test before approving for an expensive treatment option or an expensive test like MRI or CT scan. And that exactly happened in my case. I had to first try just pain medications, physical therapy, and got X-ray. I did all that for 6 months, and when nothing worked, then my doctor was able to get my MRI approved from the insurance. But by that time, I was already limping and half of the damage was already done. Anyways, fast forward to the part which I guess everyone is curious to know, that how I got relief from sciatica pain. Well, most people get relief from sciatica pain by using pain medications for sometimes physical therapy or stretching, but for me, I had to get surgery. Because when I got the MRI, literally an hour later, I got the call from my doctor. And I really today, I still remember that call. So my doctor calls and he goes, Sidra, you have a really big herniated bulging disc, which is pinching your nerve, which basically helps in your mobility and bowel movements. So go to the ER, and I've already sent your reports to the surgeon there. And once you get there, just let them know I've sent you, and they will admit you right away and perform surgery. And I was like, wait, what? Because literally an hour ago, for me, everything was just fine, except that, okay, I was limping and in pain, but nothing serious. So I got all confused, and at this point, I'm still on phone with my doctor, and I'm like, but what if I want to wait for my condition to get better and not have surgery? I guess that's what most of the people will say, right? And to this, my doctor responded, Sidra, you're in your mid-20s, and do you want to be paralyzed for the rest of your life? Because if you wait, the severity of your symptoms may result in quad equina syndrome. You must be like, what is that? Yeah, I had the same feeling. So I'm gonna put the definition of this fancy syndrome down here because yeah, it's weird. So yeah, I went to ER and the next morning had surgery. The surgery honestly did help me. I did not suffer from that kind of pain ever since. Well, knock on the wood, I hope it doesn't happen again. Because of course, now I don't have the herniated disc pinching my nerve. And surgery, I think, also prevented my condition from getting worse. So do I recommend surgery? Yes, if this is suitable for your condition, if you have a condition similar to mine and your doctor recommends or surgeon recommends that yes, you need a surgery, then yes, go for it. And I would recommend that the sooner you get it, the better. And I say that because you know what surgery didn't treat for me? The damage already done. The limp I had before surgery stayed after surgery as well. In fact, it was pretty obvious for almost 2 years. I was actually 6 months into the surgery and I had tried every physical therapy, every chiropractor that anyone suggested, but nothing changed for me. I went to the podiatrist, I got x-rays done, but nobody could understand why am I still limping. Almost a year passed, I was still in this condition, so I went to my doctor because I was planning another trip abroad. So I wanted to make sure that everything is good. I got another MRI and my doctor is like, everything looks fine. And I'm like, if everything is fine, why am I still limping? And my surgeon goes, Sidra, probably this is what it is. Your muscles are weak and there's probably an irreversible damage done to your nerves. So, you know, just live with it. You're probably gonna have to live with this limp for the rest of your life, and it may not go away. By that time, I had suffered so much agony. My doctor had still not given me okay to work out by then. So at the end of my session with the doctor, when he asked me, do you have any questions? And I'm like, yes. Am I able to work out? And he's like, yeah, go for it. If you are able to, then yes. So really, since I had suffered so much, like nobody understood what's wrong. I had put on 30 to 40 pounds weight. So at that point, I had this voice in my head telling me that, okay, believe whatever your doctor is saying. But then there was another strong voice in my heart that was just telling me not to give up, not to believe what the doctor has said. If he is giving you an okay to work out and you're fine working out, strengthening your muscles again, and the way I used to do weightlifting and all, if he says it's okay, then maybe just try to go back to your normal life, the way I was living my life. You know, before everything happened, I was working out in the gym, doing weightlifting and everything. But I had stopped doing all this for a year span. And in this year span, my life had completely changed. So at this point, I decided that no, I'm gonna shut the voice in my brain that's telling me that no, I cannot do it, rather listen to my heart. And honestly, in this whole process, I am really thankful to my sister and my mentor for supporting me and not allowing me to push myself in the darkness. They actually rather helped me come out of that darkness and just go the right direction. So that's when I decided to become friends with the positive voice inside me and started taking baby steps towards strengthening my muscles. I started eating good and I decided not to live in misery, rather I was ready to fight it. And literally when I made that decision, that's when everything started to line up for me. I started losing weight, I started sweating in the gym, worked out hard with my trainer, gained more core strength and leg muscle strength, which ultimately started helping with my limp. And really, like 4 months into that workout, I went to see my doctor again and he was like amazed and he's like, well, this is really a miracle. And in my head, really at that point, I was thinking, well, thanks for giving me those bad hopes, because had I listened to the doctor and had I listened to everybody else, like the chiropractor and therapist, I wouldn't have improved. So really, I feel this is what I recommend you, that don't give up on yourself. This is your life. You have to take charge of your life. Live a healthy lifestyle, start working out, focus on your goals and start working towards that. And honestly, now I am just so thankful to God for re-gifting me the blessing of being able to walk and run again. You know, often we may take this and many other blessings for granted, and trust me, you will realize the importance of tiniest blessings when they're gone. So really, take time to be thankful and count your blessings every single day. And I guess that's the message I want you to have from today's video. The whole reason of sharing my journey is that you learn from my experience. All right, guys, Last but not the least, don't forget to watch my video on simple stretch exercises that I've been doing to prevent sciatica pain. These stretch exercises are great to help relieve the sciatica pain. I'll put the link in the description for you so you can go watch that or click the I button up there and enjoy. For now, I'm gonna take off emphasizing on the little note that the whole purpose of today's video and sharing my story with you guys is so I can help you learn from my experience and get inspiration. Because really, life is so uncertain and short for you to experiment everything yourself. So why not learn from the experience of others? If you are suffering from some dreadful disease, bedridden, or are sick, just listen to your body. No dancing around all night because you feel better. Just give your body some time to heal. Do not give up and always stay positive. And remember, all the good things meant for you will be there waiting for you when you recover. Hope all of you are safe and healthy. I'm sending good vibes and lots of love your way. Bye.